here we are going to talk about the nursing principle and ethics. It is important for NCLEX board. The first terminology about the veracity. So veracity means to conformity to the fact or accuracy. And veracity, easy way to explain the principle of veracity are truth telling or obligation to full and honest disclosure. So veracity, they said, adherent to the truth means the duty to do what one has promised. Like today, I need to go to the hospital to care of my patient, and tomorrow also I will go. I went to today, but tomorrow suddenly at the 11th hour, I made a sick call or I not go there. So as a healthcare provider, as a nurse, it is not legal. So veracity means the duty to do what one has promised. So if you give the word, tomorrow I will be there, you should go. And liabilities, what is liabilities? Liabilities, the state of being responsible for something, especially by the law. Okay. So it is also nursing ethical principles. When you work, we have to follow all of this. So under the nurse liability law, the nurse can sometimes be directly liable for injuries they have causes to a patient. So this is usually on the basis of negligence law in addition to the defined malpractice theory. So liability say the obligation one incurs or might incur through the acting or failing to act. So what next? Next here, what is the malpractice? Malpractice means improper use of one's professional duties or failure to meet the care standard that causes the harm to the other person, right? So next one is called negligences. Negligences means the failure to provide care that a reasonable person would perform in the similar circumstance. So if you neglect your patient, you know about how to take care of the bad sore, but you neglect it and patient develop a very bad ulcer. So you fail to provide the care that a person would perform in similar circumstance. This is negligence, right? So how you differentiate the negligence beneficence or non malpractice, you have to know. Okay. And what is liable? So this is the defamation by writing or printed word or picture. So like I have one complaint with my coworker and I went to the team leader or nurse manager and I said he or she did something. It is my complaint again about. And when I complain through the writing form, right? Writing, this is libel. And slander means it is defamations of character by speech. So what is my complaint against you? I went to the nurse manager and I verbally complain about it. What I spoke about, right? So next here, beneficence. Beneficence to do good. Example of beneficent actions or resuscitation a drawing victims or encouraging the smoking cessation. These are one of the example of beneficence. Let me tell something more. Like the equitable distribution of potential benefit and tax to determine the order in which clients should be cared for. To do good, beneficent action, resuscitation, withdrawing. Like a person going to die and you start CPR, means you are trying to give the life, save the life. So this is beneficial. A person is a chain smoker, encouraging stop to smoking, it is beneficial, right? So when you read this, it is same time it is good to give an example or read example. So like as I told you, beneficence, a nurse's duty to do what is in the best interest of the client, right? So if a patient has a heart fail, so you have to take the steps prevent the disease. Means as a nurse, it is duty to do what is the best interest of your patient. Then what is non-maleficence, right? Non-maleficence means a nurse duty to do no harm. Beneficent to do good, non-maleficence not to do harm or to do no harm. So as a nurse, it is your duty to do no harm, right? Do not do any kind of damage to your patient. How you differentiate non-maleficence with autonomy? Autonomy means the right of a client to self-determination. Example of non-maleficence action, stopping a medication that is shown to be harmful. So if your patient taking too much opioid, and opioid can cause respiratory depressed, patient can die. So you can stop your patient not to take. So it is what you're doing to stop the patient to take the excess opioid means to do no harm, right? So non-maleficence, as I told you, it is the obligation to tell the truth. Also another example, right? So as I told you, non-maleficence, like a patient need to the surgical operation. what are the advantages of the surgery and what are the disadvantages of the surgery. Both you have to explain. Obligation to tell the truth, non-maleficence. From beneficial, compare contrast, as I told you, beneficial means equable distributions. The potential benefit and tax determine the order in which client should be carried for. You have a 5 patient or 4 patient who you need to go fast. What are the priorities? And you save your patient life. Step up, but decide which one will get your service faster. And then let me talk about what is the assault, battery, and false imprisonment. Now, I'm going to explain assault and battery. Assault means to threaten to touch, and battery means touching someone without consent. So, because of our healthcare provider, sometimes we need to examine the patient, but always keep it in mind. We will not abuse my patient, right? We need their permission before to start the examine. We have to explain what I'm going to do. When they permit, I will examine them, right? So if without their consent, if you touch your patient, this is called battery. So battery means any unlawful physical contact influenced by one person upon another without physical consent. Battery actually it is injury is not necessary, or person must intend to do bodily harm. And what is assault? To the threaten to touch. So any attempt or any kind of threat to carry out a physical attack upon another person. Let me give another example. Like your patient do not want to take medication and nobody like to take medicine. If you say, if you do not take medicine, I will not give you the lunch or dinner. If you say, if you do not take medication, I'm going to complain against you to the team leader. So it is threat, right? If you say, if you do not take food or if you do not take the medicine, I'm going to restrain you. This is the threat and this is assault, right? Now, let me talk about more about the justice, veracity, fidelity. Justice means the respect for an individual's right to self-determination. Like your patient diagnosed with a bad disease, you explain everything, what are the different treatment modalities, but your patient refused to take your treatment, right? It is your patient right to take the decision what she or he does. So respect, and I have respect there. Whatever I'm doctor or I'm healthcare provider, nurse, I give them option, but choice is there. And I have to respect their right. So respect for individuals' right to the self-determination. I can explain. You decide what is good for you. And veracity, I said, the duty to do what one has promised. And what is fidelity? Fidelity, basically the duty to do good to others and to maintain a balance between benefit and harm. It is called fidelity. Fidelity is keeping the faithful to ethical principle, right? And definitely, because of fidelity, we have to follow ANA code of ethics for nurses. Okay. So what next? There are three more keywords or terminology I want to share. One is autonomy, confidentiality, and accountabilities. Autonomy means the right of a client to self-determination. Let me tell one more time. The right of individuals to make the decision for themselves. And there is autonomy. Let me recap it. Autonomy means, I say, the right of a client to self-determination, but some books said it is the obligation to do or cause no harm to others. It is autonomy. And confidentiality means the maintaining the client privacy by not disclosing personal information about the client. And what is accountabilities? Accountabilities means responsibilities for others' action, right? What next?
Yeah, I can tell those.
So next one here, we are going to talk the false imprisonment. Means the false imprisonment
It's
means
gonna rain all the weekend.
when false imprisonment, when, for example, a client is made to believe they cannot leave a bed or room or the floor. Also, unauthorized use of physical, chemical restraint. So restraint is three categories. One is physical, like you tied up your patient with a belt. Or chemical restraint means you give the sedatives, opioid, and patient sleep and you sleep as well at the night duties. So it is the restraint, but chemical. And false imprisonment means when a client is made to believe they cannot leave the room or floor, also unauthorized use of the restraint. Authorized physical restraint must be checked every 15 to 30 minutes, depends on agency policies, right? And it is all the times ordered by the doctors. Release every 2 hours in order to provide the ROM exercise and also comfort measure. We have to check the neovascular circulation. We have to check arterial supply, venous supply. We will check the nerve supply, right? Every 2 hours. What next? And next here, the informed consent. So informed consent, this must be obtained from a client or their healthcare proxy for any invasive procedure. So like a patient needs surgical operation, like patient has a tumor in the neck and need to operate or surgical excision. So as a healthcare provider, we will explain what are the treatment option, what are the surgical procedure, right? And after that, we will take their written consent. Usually doctor supposed to take the consent from the patient, and nurse supposed to be there as a witness. So it is obtained by the healthcare provider like physician, while the nurse role is to ensure the consent is signed and in the client prior to the procedure, right? So healthcare provider teach about the procedure, right? Not the nurse. But if patient need re-educate, reinforced, then times nurse can do this. And nurse have to make sure doctor take it out before start the surgical procedure. What is invasion of privacy? So everyone in the medical team must maintain the privacy of the client medical record as well as her or his personal physical privacy. For example, close the curtains or door when the client would otherwise be exposed. Also minimize the computer screen. Like you are working on the monitor where the patient history is there, particulars is there. Another part, like a medical student are there, it is good to minimize this your computer screen. It is the privacy for your patient. Emancipated minor, it means a child is freed from parental custody and can become an adult in many ways. When a minor marries or joins the armed force, like a girls under 18, but she got pregnancy or she married, she's emancipated minor. A boy under 18, but already joined in US Army Force, they are emancipated minor. So with the parents' consent or permission from the court, she or he become emancipated from his or her parents. So emancipated minor is one who is no longer under the legal control of his or her parents. And emancipated minor are responsible for their own conduct. Minor are automatically emancipated when they get married or set up their own household. Minor may also look for a court permission for emancipated by the using for emancipation law. Minors who claim to be adult are commonly fraud. And in some states, when minors lie about their age and their insist on getting out of a contract, the other parties may sue the fraud. And this state still see if it is a criminal offense when the minor lie about their age to get age restricted product such as cigarette or alcohol. So it is defined, right?